and I'm gonna get my face out of here. All right, we're live.
Hello, this is Bill, the knee pain guru, the best in the world at eliminating knee pain without drug shots or surgery. Welcome to the Knees for Life Google Hangout. We have an exciting next hour coming up for you. We have a few people confirming. Neil, we have like two people we're going to be talking with. I think Fadia is going to be online.
Fadia, unfortunately, couldn't make it, but
Okay.
we have some really good questions coming in from both Inner Circle members and non, so we're ready to rock.
Cool. Okay, we're going to answer some great questions. The topic of today we're going to cover is does physical therapy really work to eliminate your knee pain? Which I find is a really fascinating topic to really get into, because so many people look at physical therapy or strengthening the muscles in the legs as being a solution to eliminate the pain in the knees. And we're going to go into that deeper as to making distinctions on what is actually going on when you do physical therapy or when you're going to your conventional physical therapist, as far as in the broader scheme of things, whether it's helping with your knee pain or not. So make sure you stay tuned on the call for that as it comes up. For those, if you do have questions, you want to make sure you go down below this video in the chat section and start entering in your questions, because we do have like a couple-minute delay between the time you put in your question and when we actually see it to be able to answer it. So I want to make sure I get to all your questions today. So with that being said, let's get on to the topic of whether physical therapy is actually helping or hindering you from eliminating your knee pain. I've been working with clients online now for 6 years. And one of the most frustrating things I get is the question, what exercises do I need to do to eliminate my knee pain? There's this mentality out there that exercise or physical therapy is going to be one of the shortest ways of getting you out of knee pain. Before we get into the exercise piece, we have to zoom out. We have to get a broader perspective of what's actually going on in the body, neurologically. Everything I look at is from a nervous system level. The nervous system is the electrical system that sends a signal from your knee to your brain that you have pain. And if we're blindly going in and just beginning to strengthen the muscles in the legs in an attempt to get rid of the knee pain, we're not really understanding the body on a deep enough level. And what I'm talking about is when there is an injury, when you have pain in the knee, what's happening is the body tenses up to protect itself. It's like a neurological workaround. You can think of it like wiring in a house, that we're doing a bypass of a switch in order to get the lights on. And your body is compensating. So in the case of your knee, what happens is the hip begins to pull up to protect the knee. And we bend the knee. You go onto the ball of your foot. The weight shifts over to the other side of your body. So your opposite hip, your opposite knee, your opposite ankle, and your opposite foot compensates for that. It also goes up into your lower back. Your lower back compensates, and you could even see the tension going to your shoulders. So your whole body is doing this neurological rewiring to protect the knee. And that's just from a simple knee injury. We're not talking about surgery. We're not talking about something that's been going on for years, like degenerative changes, arthritis, bone on bone. We have other stuff going on with that. But just for a simple knee injury, the body does this workaround to protect itself. Natural. It's natural for your body to do it. It's natural for your body to protect itself. This is all the way we are hardwired as humans to keep us safe so we don't injure the knee more. When we go back into our lives, we give the knee time to rest. You go to the doctor goes, oh, there's nothing broken or torn in your knee, you just sprained it. Or you have a diagnosis like patellofemoral syndrome or patella tendonitis or something that's going on in the knee that's causing pain, but it's not mechanically damaged. The knee is not mechanically damaged. What happens is we still have, even though there's nothing wrong with the knee, we still have this workaround going on in the neurology of your body, the wiring of your body. So now you go back in and it's like, okay, the knee's kind of feeling better, but I'm still a little hesitant, but I want to exercise. You may get sent to physical therapy, or you may just go to the gym on your own. What happens is you go there and you start pushing your knee. You start strengthening the muscles in your knee, in your leg. The muscles in the knee. I say there's no muscles in the knee, which there aren't. There's only tendons and ligaments. You strengthen the muscles in your legs in an attempt to eliminate the knee pain, to protect the knee so it doesn't get injured further. But we're not taking into consideration the neurological rewiring the body has taken on to protect the knee from being injured further. So it's like taking a house on a crooked foundation, and now we're adding more stories to that house. We're adding more weight to that crooked foundation. And it really sets up the body for more injury. Because now the knee is the weakest link in the series of tension from the head to the feet. We have this compensation pattern. The body has shifted away to protect itself. The knee is being protected by the rest of the body. And now we're trying to push the body with strength exercises than the knee. But it's not actually the knee that needs to be looked at. We need to look at this neurological rewiring from the head to the feet. So, you're at the doctor's. The doctor says, do your RICE therapy. RICE, rest, ice, compression, and elevation. And now you need to go to physical therapy after a few days. And you're going to physical therapy for days or weeks or possibly even months. I've worked with clients that have been going to physical therapy for months, and you're not seeing any improvement. And the reason why you're not seeing improvement is because we haven't addressed the body on a deep enough level to take that crooked foundation and make it even again, to balance that crooked foundation. So now when you stack that weight on it and you start pushing the body, you have this solid foundation to push off from, which creates sustainability and longevity in your joints. So to go back to the original question, does physical therapy really help to eliminate your knee pain? To answer the question directly, yes and no. How about that for ambiguity in an answer? No, if we don't balance the neurology in the body, if we don't relax the tension patterns that are causing the imbalance, and we do the physical therapy then, no, we're going to cause more problems. But if we balance the neurology, if we get the body with a balanced, solid foundation, so the body feels confident and supported and assured of itself, then yes, physical therapy can be beneficial. So it's all in the timing. I think of it like a recipe. You have to have the right ingredients in the right amounts, in the right order, with the right timing. And if you get any one of those ingredients out, you don't necessarily have what you were trying to make in terms of the recipe. Think of a cake. You have flour, you have sugar, you have eggs, you have baking powder, you have all of that. Well, think of it if you just took the baking powder and the eggs and threw it in the oven. and pulled the baking powder and the eggs out of the oven after it had been in there a while, and then put the flour in there and put it back in the oven. You know, you could see if you do this out of order, if you do the recipe out of order, what's going to happen is you're going to have all the same ingredients in the cake, but you're not going to have a cake. And that's my point with knee pain. So many people are unnecessarily suffering with knee pain because they don't do the right ingredients in the right order, in the right amounts, with the right timing. Physical therapy is no exception to that. And physical therapy, in the greater scheme of things, I look at it like a continuum. You have sitting on your butt, resting, you know, your RICE therapy, rest, ice, compression, and elevation, where you're laying there on the couch with ice on your knee, waiting for the swelling to go down, usually taking Advil and Nuprin and ibuprofen and stuff like that to get the issue resolved. And then you have physical therapy. And you have this huge gap between those two, sitting on your butt and doing physical therapy. And it's kind of a crapshoot if you just get off the couch and then go to physical therapy to try to get the pain out of your knee. You're going into the exercise with fear, you're hesitant, you're favoring the knee, you aren't sure if it's going to be better or worse, or if you do the exercise, that you're going to have pain for days or hours or days later. So all of that plays into what's going on in your body, the cascade of hormones that are created as a result of that workaround, the neurological workaround that the body does to protect the knee. So essentially, the Knees for Life program functions in that gap. We want to go from sitting on our butt on the couch in physical therapy and do a whole spectrum of conditions that you set up so the body can heal the knees, so the body feels safe, supported, and listened to, and optimize the body's ability to heal itself so it can recover faster. So this is where we're working. No specific steps or mindset. That's the first thing when I work with clients. Mindset first, then we look at water, nutrition, breathing. It's all about the nervous system, that neurology that we're talking about, relaxing the tension in the nervous system, setting up the conditions so the body can heal the knees, because the knees are not priority in terms of healing. If we have other issues because of lack of water or improper diet or lack of breathing because our body is tensing up and holding our breath to protect the knee, those create problems. Those create blocks that are in the way from the body healing the knees. So we got mindset, water, nutrition, breathing. And then we create comfort. And that is working with the intrinsic movement of the knee joint to get the pressure off of the nerves. The only thing causing the pain or the irritation of the nerves. Then, and only then, when the body works in that place and the pain is reduced, so now the body feels like, oh yeah, it wants to move, it wants to do things because it's not afraid, then we can go to physical therapy. Huge gap between sitting on our butt and physical therapy. So that is what we're going to cover today, answering the question, does physical therapy help in your knee pain? How are we doing on time there, Neil?
We're doing good. You want to dive into some questions?
Yeah, let's do that. Oh,
Yeah.
For those that are watching this from someplace that they may not know where to go to thekneepainguru.com. Check out the website, get on the newsletter, receive the information, start absorbing the stuff that's on the website. It's really good information, It's not out there anywhere else unless it's been copied from my site, which is a good thing. And yeah, get in the conversation. And if you are so inspired, the Knees for Life Inner Circle are for people who are really serious about having strong, healthy knee joints to last the rest of their life. It's a supportive community and environment where you have access to my the virtual knee pain clinic, which are videos that I've created working with clients, one-on-one clients over the past 6 years. You also get the ability to ask questions where I answer them directly in the 2 Google Hangouts per month, as well as a private membership to a private Facebook page where you have the community of other people that are dealing with knee issues.
All right, that's great. And in fact, talking about that Facebook group, I'd like to go into a question from Dee from our Knees for Life Inner Circle, and a question that she posted on our Facebook group. She said, well, I've been in a hellish situation for about a week. I have been seeing a massage therapist on and off as needed for the past 3 years. I had some deep myofascial work done last week on my entire back, targeting the intercostals in particular, as well as pecs, psoas, hips. First time ever I got hurt with a probable small cartilage tear in one of my ribs on the right side. Was seen today for evaluation. It would appear that the rib is not broken, as I passed all the tests for that, as well as having no physical evidence such as bruising or protrusion, etc. I could have an x-ray, but it's probably a waste of time. Let's see. I was told to not do the exercise Bill suggested for me until cartilage is healed. When I pull or push, it hurts. And of course, I would have to pull or push to do the exercises, and I run the risk of tearing it further. So I will not be part of the podcast because she was supposed to be on live today, but she'll be listening to it at home. I can only do passive stretches for the psoas with rolled towel under the knees. Passive stretches for hands and hips requires laying on the stomach, which kills me with torn cartilage, especially trying to get from that position up. Mostly have to sleep on my back, although I can sleep for small stretches of time on the right side. So getting up from sleeping position and starting and getting down into it has not been fun. So that's the state of the union for her. Bill, any ideas I can do?
Yeah.
So that's her question.
Yeah, I got lots of ideas. Well, one is as far as like the passive stretches to be able to do with her ribs, she's pushing too hard to find comfort in the knee. Many times the passive stretches you don't need to put that much effort into doing a passive stretch in order to get the comfort in the knee. If she's pushing to the point of tearing something further in her ribs, then she's putting way too much effort into it. And it sounds that's like a pattern that I've seen both in myself, former knee pain sufferer, and the people that tend to be the type that suffer with knee pain is you put way too much effort into it. I've worked with clients. It's like if I told them, I said, go run a marathon tomorrow, and you'll be out of knee pain, and they would totally do it. They'd be like, oh, well, if I run 2, will I get out of pain faster? And it's like there's this type A mentality, this very driven mentality, and what it makes this program challenging for them because they actually have to do less to get better results. So that is a big thing as far as what I convey to Dee is she doesn't have to put nearly the amount of effort to get better results. So that's one thing. As far as like what's going on with her ribs, I haven't a clue how a person doing myofascial release or deep tissue release on a person's back can actually tear something in the ribs. That's pretty rare, and I highly doubt that there is something torn, at least in my own experience with body work over the past 16 years. So I'm suspecting what's happening is there is just a tension pattern that is going on in the ribs. And by taking the tension off of that tension pattern in the ribs with a passive stretch, you can get the body to let go of that pattern that's causing the discomfort. There's that. Another thing is I would scale back on what she's doing. You know, I've kind of watched the threads of the things that she's left in the inner circle, and generally she has this huge laundry list of all these different modalities that she's doing and things that she's trying and exercises that's happening, and it's like it just doesn't need to be that difficult. And honestly, if the people that are most successful in the Knees for Life program are the ones that just stick with creating comfort in their knees and setting up the conditions so the body can heal itself, which involves mindset. And part of the mindset is to not do more things than you need to do. It's just do the minimum that needs to happen to get the minimum effective dose that'll give you the best results. And then, of course, looking at water, nutrition, and breathing to set up the conditions so the body can heal, and focusing on just doing the passive stretches, which is creating comfort. So with that being said, you know, what she wrote in there has nothing to do with her getting better. It just has a lot to do with like a story we have about getting stuck on this hamster wheel. That'll be a pattern that she's seen, you know, not only with her knee now, but you know, in her lives. That may be a little bit too deep or too much, but it's that with everybody, myself included. It's like we have these same patterns that create the problems that we run into.
That's awesome. Bill, I feel like maybe we could talk a bit about that shift in mentality of, you know, looking for every type of relief possible. You know, like focusing on, well, if I get more work done on me every week from different modalities, that I can heal faster, and putting yourself in that mind frame of like getting out of what you feel like, you know, you ought to be doing versus like kind of getting into the mind frame of what you're talking about.
Yeah, I mean, it's like a person who wants to hug somebody with straight arms. It's like they're running around to everybody, and it's like, well, why can't I get a hug? It's because they're not bending their arms. So they're always at this distance from getting what they want. They're running around like everything's an emergency. They're trying to put out fires all the time, and it's really about slowing down. And this is in order to get into knee pain, we've had to ignore for days or weeks or months or years what was going on in the body. So we ignored how the body felt. And now what's happening is so our body's finally saying, okay, you can't ignore me anymore. You have to pay attention to how I'm feeling. And if you don't pay attention to how I'm feeling, what ends up happening is it just ends up hurting worse. And this is the piece that is missed so often in getting out of knee pain. And the way to get out of knee pain is to feel how to get out of knee pain. We can't just do exercises to mindlessly get out of pain. We have to feel how to get out of pain. And I use the analogy with my clients that it's like backing out of a house in the dark at night with your eyes closed. And every time we hit something, that's pain. And we have to negotiate our way around these objects, the chair, the wall, the table. Every time we hit something, thing that's pain directions and find comfort and make comfort the new reality. And this is what's happening. I mean, I did it as well. It was like I did a ton of different modalities, and I tried all these different things, and what was happening is it was like, God, why isn't this working? And the interesting thing is the moment I got out of pain, I went to judo and dinged myself up again. And then I was like, I'm in pain again. Why isn't this working? But it did work. We were just too busy going to the next thing to actually realize that it worked. Is that making sense? Is that answering the question, Neil?
Oh yeah, for sure. And just to review with everyone, why don't you tell them how many times you did that? Jump back in and get hurt again before you started really. Yeah.
Oh, I dislocated my left knee 4 times. Yeah, my learning curve was pretty flat.
And it was mostly sports related.
First time in skiing, and then judo, all sports related. Skiing, judo, volleyball, softball. Went to the doctor. And then the doctor told me my ligament was torn. And then I had surgery. I did the physical therapy, which strengthened the leg, but it didn't get rid of the pain. So pain and strength are not, they don't equate. So that's what this journey is. It's been, well, it was May of 99 was when I dislocated it the last time. June of 99 was when I had the surgery. So I did physical therapy for a couple months after that, so that'd be June, July, August. And then since then has pretty much been my journey to what you see now. It's been learning and traveling and studying and finding out what works, getting to the nitty-gritty of really like what gets results. And now it's like it's insane. Like I'm even impressed with how quickly that if people follow this formula, this recipe for getting out of knee pain, how quickly they get out of pain. It blows my mind. Like I had Drew. He's in where is he? In London, Ontario. And he had meniscus surgery, and his knee was just really, really a mess, and couldn't do physical therapy. It was like he was going, well, gosh, how am I going to play with my son? His son's 9. You know, wanting to do stuff with his son, and he couldn't do it because of the pain in his knee. And then, you know, there was the time that led up to the surgery, and now the time after the surgery. So if you have several months before and several months after, you get this hopeless experience of like, gosh, is this ever going to change? And it's like it was hard for him to go to work. It was hard for him to have a relationship with his wife. He's cranky. You know, he can't play sports. His thing, like he just wanted to walk normal. And I got it out of him. Like he really wanted to play basketball. Like that was his passion. And I was like, yeah, you'll totally play basketball. Give me 6 months. I can get you there. And he couldn't believe it. Like, okay, fine. You know, you'll get me out of pain, but he couldn't equate the basketball piece. And we started working 10 days into it. He's like, oh my gosh, I could totally see me playing basketball in 6 months. And we'll probably do that before then, because he has totally thrown his hat in a ring, jumped over the fence and committed to the program, and he's getting great results like every week. I'm hopefully, this is something I was going to tell you, Neil, have him do like a short little video sharing his story over the past month, because it's only been it's a month tomorrow that we started working. So
that's fantastic. I can't wait for that, and we'll post that and remind everyone and share that with everyone in our email list and our inner circle, for sure.
Yeah. We got more questions?
Oh yeah, absolutely. How about this one? This is from, where is she? Lorraine. I am a 63-year-old female and retired combat Army veteran, injured my left knee in Iraq. I had continuous pain and swelling. I was losing flexibility. In 2014, I had a total knee replacement. It was successful. I had no more pain and swelling, but now my range is about 65 to 70%. I was not aware I had to do exercises every day to stop the stiffness. Can you recommend anything? And for the stiffness as well as pain when it rains.
Yeah, I don't have a whole lot to say for a person who has a knee replacement. Yeah, I mean, unfortunately not. Um, the Remember I was talking about the physical therapy and the body does neurological workaround when it has an injury. Or first of all, I'd like to thank her for her service. I think that's fantastic. She was a veteran, so I appreciate that. Um, but in terms of what I'm able to help a person with once they've had a knee replacement is pretty limited, because once they cut the bones off in your leg, and most people don't know this when they talk about a knee replacement, is they cut the bones off in your leg and replace them with plastic and metal, and they put a screw down the length of the bone to fix the joint in there. And they generally, Lorraine is kind of young for a knee replacement. They usually wait till people are older because the knee replacement's only rated for maybe 10, 15 years. And the doctors are hoping that you're going to die with it in so they don't have to replace the joint again when the joint wears out, because it's only rated for the 10 to 15 years. So they wait till people are in their late 60s into their 70s before they'll do a joint replacement on it. No matter, and they're in a pain management, they're in a holding pattern until they're old enough. So the thing as far as like the knees, you could still do the foundation, which is mindset, water, nutrition, breathing, where the body is able to set up the conditions so the body can heal itself. But in terms of the results you get from the passive stretches and exercise and things like that, it's really spotty, because once they cut the bones off in the leg and you have bone connected with plastic or metal, you have a totally different animal there that I honestly don't understand, and I don't know anybody that really does. There's this mentality in Western medicine that, well, what ails us, cut it out. And it's okay in the short term, but for sustainability and longevity of the body, it really doesn't exist in that paradigm.
Got it. And could you kind of go a little bit deeper into that as far as the nervous system being cut off? And I know that you talk a lot about the nervous system being that electrical system.
Yeah, I mean, they're severing the nerves that are in the bones, and they actually they cut the knee open, they move the kneecap aside, and then they cut the bones off in the leg and replace it with the plastic and metal, and then they put everything around it. So there's actually no ligaments anymore in the knee. There's no ligaments whatsoever. So the big thing a person with a knee replacement has to do is strengthen the muscles in the legs, and that's the only thing that's holding the knee from dislocating. Generally, as far as the range of motion, a person with a knee replacement can't squat past 90 degrees. So your heel will never touch replacement surgery. That may sound a relief as far as the pain goes, but in terms of really living and enjoying your life, yeah, I don't know. As far as your sex life, it goes pretty much downhill from there. You can't bend your knee. There's a lot of stuff in that realm that doesn't happen because you can't bend your knee fully. And just simple things like squatting down or going to the bathroom, that's something that no one really talks about, is how difficult it is when you have an imbalance of when you can't fully bend your knee. That makes it very difficult to fully eliminate when you go to the bathroom. So Uh, and that's all controlled by the nervous system, which does this workaround. You have this pattern that is now permanently stuck in the body that there's no way of ever working it out because of the surgery, because of this plastic and metal that's now held in the boot. So it affects it. Although, there's a couple of things that come to mind. There's arnica tablets, sublingual tablets, homeopathic, I think could be beneficial, as well as arnica cream. I used to suggest Tramiel, but there's this whole legal thing with Boreon, which is the manufacturer of Tramiel, that they're no longer, it's a European company, and they're no longer selling to North America. So Drew found that out about a month ago. But I am looking with, and Neil, this is something I wanted to talk to you about, Dr. Frank Charles, the guy with the PEMF machine out of Greenville, South Carolina. He has lines of homeopathics and supplements like that he's put together for specific issues that I'd like to get up on the website at some point in time. Packages.
That's great, and we'll keep everybody informed on that as soon as we can get that up on the website. Then y'all can start viewing it and asking some questions and get those mailed to you. How about another question?
Yeah, let's go for it.
All right, Gary asks, I am 61 now. When I was 12 and again at 19, my patella slid to the rear of my knee.
Ooh.
Now I have knee pain. Wow. That makes it hard to walk and nearly impossible to do stairs. I went to the knee doc. He did x-rays and told me I had arthritis. He wanted to drain fluid and give me cortisone. I refused. I have no clue as to anything I did to traumatize my knees. I get most pain removing my left shoe by using the right. Also, moving the right knee towards the right knee. Right knee towards the right knee. That was a typo, apparently. What do I do? How should I fix it?
Right knee towards the right. Did he say if there's any pressure, like when he takes his right shoe off of with his left foot?
Right. Removing the left shoe by using the right foot.
Oh, okay. Got it. That's actually probably one of the best examples of someone describing how they have knee pain. It's so simple. Because it's not a medical diagnosis. It's like you think of it like a little kid saying, "Well, how does it hurt?" Well, it hurts when I, stand on the outside of my foot. That gives me more information than a medical diagnosis ever will, and gets us closer to getting out of pain. So what I would do, and I'm going to go into the virtual clinic right now. For what he would need to do, I would have him go into the log into the virtual clinic, go into the stretching lounge, the passive stretching section, watch the intro video, and have him do modules 1 and 2 and see how that changes, how that feels. And if he gets more specific in the knee, like on the outside of the knee, below the knee, above the knee, however it moves is going to give us an indication as to like zero in. Like I was saying, we back out of the house and we run into something. So right now we backed out of the house, and we know that if we take the right shoe off with the left foot, we have pain in a certain way. So there's a certain pattern that's going on that's causing the pain. Those two passive stretches, modules 1 and modules 2, will start relaxing that pattern. Like today, exactly what he said is going on today. That's going to address what's going on today. We create comfort there. It may be different tomorrow. And the knee is going to maybe have a different pattern, a different tension pattern, hurt differently. And when it does, that feedback is going to give me an idea of the next comfortable stretch that is going to move him closer to being completely out of pain. So that's what's hurting, but the bigger issue is the kneecap dislocation. And that is a function of a loose patella tendon or a kneecap tendon. And that is, you want to make sure that the water intake is good, so is body weight divided by 2 ounces of water per day, as well as nutritionally. A lot of times when we have grains, dairy, and processed foods, that makes the tendons and ligaments weak in the body. I could feel it if I kind of go, when I travel, sometimes I don't eat as good as I normally would, and I don't eat as much protein or good fats and vegetables and fruits as I'd like. So what ends up happening is my joints just don't feel right. They feel weak. They feel floppy. They don't feel strong and solid and all that. So when I get back from traveling, I, immediately, plenty of water, I'm getting plenty of sleep, making sure I'm setting up the conditions so my body can heal, and I get the food real solid so, it can heal. It can feel better.
You want to talk about, just for a second, that piece on arthritis. I know that we've covered that in the past in videos, but it's just so important, that idea of walking away from that doctor that says drain the fluid and shoot it up with cortisone.
Yeah, the arthritis piece is, all arthritis is diagnosed as dehydrated joint. And it's because there's a tension pattern that's squeezing out all the fluid in the knee. Just like if I squeeze my hand just for a little bit and then open the hand's going to change color. And it's because just that tension from me squeezing the hand squeezes out the blood and the oxygen in the hand. And I create the fist. But as soon as I relax the tension in the fist and make it a hand again, the blood and the oxygen flow back into the hand. The same thing is with arthritis. There's a tension pattern going on in the knee that is squeezing out all the synovial fluid and creating the conditions for the joint to begin to wear, pain and stiffness to enter the joint. Now, this is not all arthritis, because there's rheumatoid and another type of arthritis. I don't recall the name right now, but the primary kind that people have is osteoarthritis, which is pain and stiffness of the joint. And this applies to the majority of the arthritis that's out there. If we relax the tension in the joint and start increasing our water intake, as well as eat the proper food so the joint can heal, well, then we're already on our way there for the body to be able to heal itself.
Cool. You want to go through another question?
Yeah.
Okay. So Mark asks, my knee has swelling and pain 10 weeks after a partial ACL tear, which was revealed by an MRI. The knee is stable, and the doctor doesn't want to do surgery yet. And he's asking about whether any of your books or programs can help with that.
Yeah, absolutely. All of the programs and books would help with that, except for Stop Your Knee Pain Now, because that's strictly an exercise book. So all the other ones you would want to get into. A partial ACL tear, that's what I had the first 3 times before I completely tore it. And it was full. But a partially torn ligament can heal. It takes a while, but what he's dealing with after the swelling and all that is just the compensation, the workaround, the neurological compensation that the knee took on to protect from the injury. And that's the swelling, that's the pain. And that's why it's taken so long, is because he hasn't dealt with the neurological piece. As he probably has quite a bit going on, especially with a partial tear, and I'd have him look at say no to knee replacement. I know he's not looking at a knee replacement, but there's certainly consideration as to what's going on because of the compensation patterns. That's a complete program that's going to be able to get him where he needs to be.
And is there room for a case like this that seems like it's in the onset in the Knees for Life inner circle?
I'm not understanding your question.
Well, as far as would it benefit him to be in the Knees for Life inner circle?
Yeah, absolutely. I mean, he gets 3 months in the Knees for Life Inner Circle by getting that program. So that would come included in there. So a lot of my coaching clients, people who get the Say No to Knee Replacement program, get 3 months. Or my one-on-one coaching clients get the inner circle. That's part of their deal. Like as far as like the Say No to Knee Replacement, you get 3 months free in the Knees for Life Inner Circle. So you interact with me with questions like this, and I can make distinctions and stuff like I did with D and I think it was Lorraine.
Mm-hmm.
The different questions to dial in and bring clarity as to where they're getting stuck in terms of their knees healing their body.
That's great. So I'd like for you to talk about the live event coming up that you'll be at. Maybe some people will be in the area and they can come.
Oh yeah. I'm going to be in Dayton, Ohio, at the Dayton Convention Center on October 11th and 12th. I'm going to have a booth at the Mind Body Spirit Expo, and I will be speaking on that Saturday afternoon. I'm going to be talking about the recipe to eliminating knee pain that everybody needs to know, and to one, get out of pain, and two, to have strong, healthy knee joints that last the rest of your life. So they're expecting, I think, 8,000 to 10,000 people through the show, and I believe that the room that I'll be speaking in will be standing room only, from all indications right now. But I will be traveling up to Dayton. If anybody is so inclined and would like to help with the booth, please get in touch with us. Send an email to Gretchen at thekneepainguru.com. That's Gretchen, Gretchen, at thekneepainguru.com. And that's, of course, if you're in the Dayton area or vicinity. We'd love the support. But yeah, that's happening a week from this weekend.
Yeah, and we're really getting excited about that, and there'll be some more live events coming to everyone in the end of 2014 and 2015. So hopefully we'll be in your area if you can't make it to that one soon.
Yeah, absolutely.
Well, Bill, you wanna close out? We're rounding out at about getting close to the end right now, and we do have some more questions, but I think we can get to them next time, just because they keep piling in, and just talk to everyone about just closing out.
Yeah, well, I'd like to thank everyone for being on the call. I think it's great. I really enjoy this. I love it when I work with clients like Drew or Carl or Dudley or the other people that I'm working with right now, when they have that relief, when they get past their fear, because it all starts with fears, doubts, and concerns that we got to get past first in order to optimize the body's ability to heal itself. And when you do, it's like the program is there to work for you. The program can help you immensely, and you just got to decide what you really want out of your life. Get real clear, because the program's not going to work for you well at all if you're not clear. But you get clear, and you want to be out of knee pain. You want to live your life however you want to live it. Play golf or tennis or hike or bike or dance. Have that confidence when you walk and not think about your knees anymore. Then this is what you want to get involved in. There's nothing else out there like it. I'm definitely seeing what's out there, talking with people. I am definitely the best in the world at eliminating knee pain without drug shots or surgery. And I'm not saying out of arrogance or boastfulness. It's what I see as being fact, because right now the existing model is nothing except pain management until you're old enough for knee replacement surgery. So I'd encourage you to reflect on that, think about that, get involved somehow. Go to the website, sign up for the newsletter, Watch videos on my YouTube channel. Get one of my books. Sign up for the Inner Circle. Get into the Say No to Knee Replacement. Or if you want, have a conversation with me. All of those can be found on the website, thekneepainguru.com. Get involved, and you'll see your life transform in ways that you can't even imagine right now.
Thank you, Bill, and everyone that you touch, their lives change for the better. And there's been so many success stories that have happened because of your work. And Inner Circle members, I challenge you to just come into the Facebook group and just post some of your successes lately and some of your milestones that you're feeling really good about.
Yeah, and Neil, this brings up a good point. I'd encourage the people at Inner Circle members not only post successes. I want to hear the challenges. I want to hear the stuff that isn't so great, because the stuff that isn't so great is it isn't that the program isn't working. That's not it at all. The program is working. It's shifting and changing what's going on, and we can't grow unless we have that resistance, unless we come up against our edges. And that's what the program is for, so you can lean into the resources that are available through other members and through these Google Hangouts, that you can get the help and support that you need. So I'd encourage you to reach out and get the help, because that feedback is going to give you the distinction between pain and no pain. That's really important.
Thank you, Bill. Thank you, everyone, for being on the Hangout with us.
Yeah, thank you so much, Neil, and we'll see everybody. What do we got? When's our next date?
Our next date is, let's see.
It'll be the 23rd?
The next date will be the 16th.
Oh, yeah.
16th of October.
October 16th at 2 p.m. Eastern Time.
All right. Thank you, Bill.
Thank you, Neil.